what we can do in that first day to get him started out in a kind of a happy, healthy manner. So what we're going to talk about is newborn calves, assessing how vigorous they are and whether they need any help or not. And then the second thing we'll talk about, if they do need help, the most common way we do that is by supplementing the colostrum. So I want to talk about colostrum management in newborn calves as well. So we'll start about the vigor. So probably my first 10 or 15 years in practice, every time I pulled a calf or did a C-section, the first thing we did is hang that thing over a fence and watch the fluid drain out of its mouth, thinking we were doing all this amazing good for this calf because all this stuff's coming out of its lungs. And you'd think after as many years of university as I've had, I'd know that if that was coming out of his lungs, he'd be dead. So the fact of the matter is, if you hang a calf upside down, you're actually probably doing the worst thing for that animal, not the best thing for that animal, because the fluid that's coming out of their mouth is actually coming out of their stomach. It's not coming out of their lungs, so it isn't really affecting breathing. The second thing, of course, is all of their abdominal contents are now weighted on top of their diaphragm, which is the muscle that they need to breathe. So you're actually making it harder for them to start breathing, not easier for them to start breathing. So the proper thing to do is to put him on his chest, kind of frog-leg him a little bit so that he'll sit upright, and then allow him to start breathing on his own that way. That way the lungs are there's no extra weight on them, and they're both sitting in the exact same position, so they're going to both inflate in a normal and equally symmetrical manner. So this is a change in mindset from the way we did it for a long time, but it's an important thing. Is we really shouldn't be hanging these calves upside down.
You broke it. We were allowed to press 2 buttons.
I'm back. Okay, there we go. So I think the other thing to remember is, if anybody feels like playing veterinarian, then this is what the heart rate and the respiration rate that you should get in a normal healthy calf. But more importantly is knowing, I'm just going to push the button here, that you can start resuscitation procedures, which we're going to talk about in a minute, before the calf actually hits the ground. And this is really important, actually, if you've got a calf that's hip locked. And so if you've got a calf that's hip locked and it's taken you a little while to readjust the calf and readjust the calf jack and whatnot to get the calf out, it's important to quit pulling on that calf, get him breathing properly, get some oxygen in his system, and then you can go ahead and start trying to extract him and dislodge that hip lock. And feel free to stop me actually in the middle of this if anybody has any questions as we go, because I don't mind that. So if you've got a calf that's a little bit weak and you're trying to get him started breathing, what can you do? You can pour some cold water on him, and he'll have a reflex gasp that'll get him breathing. This is what I normally do, and I think what a lot of people normally do, is you stick a piece of straw or something up his nose, and that'll cause him to give a big intake of air and get them started breathing again. Rubbing their chest stimulates respiration. If you want to do some ancient acupuncture techniques, there's a little acupuncture point right in the very middle of the nose, and this actually applies for any species, not just cattle, so we use this on dogs and cats and stuff like that. So you can take a small 20 gauge needle and stick it right between the nostrils in the middle of the nose and put it in there and just kind of gently twirl it, and that stimulates pathways in the body that increase the respiration. And then what a lot of veterinarians do, and we do that in our practice too, is we have tanks of oxygen, and we will actually put an oxygen tube up their nose so that when they're breathing, they're getting oxygen, which again just gets them started out right and gets them started out stronger. So what I want to talk about now is, how do you assess whether a calf is strong enough to go on his own, or whether you should actually give them some help. So it's quite interesting how many calves don't start out as strong as we thought, and don't start out as with as much colostrum in their system as we thought. because they seem like they're all right. But when you actually go in and do research and take blood samples and look to see whether they got the immunity from the cow's milk or not, a lot of them don't. And some of the work that was done by researchers at the Veterinary College in Saskatchewan showed that it was quite common in herds for a third of the calves not to have full immunity from the colostrum. And so, that's called passive immunity, and so when they don't get it, then we call that failure of passive transfer. And so what happens, of course, is you wind up with more sick calves while they're nursing on the cow. You wind up with more calves that die because they don't have enough immunity in their system to withstand any disease pressure. And then, of course, the other thing that they've shown with research is calves that don't get enough colostrum at birth don't gain as well as calves that did. And that actually transferred all the way through to the feedlot, is that we followed those calves through the feeding period and found out that it's really important for them to get started out right and get enough immunity in that first day of birth. So, the research I'm going to show you here in a minute, the Saskatchewan research shows us that about 33% of the calves didn't get enough colostrum at birth. We also know that in the research I'm going to show you here in a minute, in that Saskatchewan study, the producers there said that about 7% of the calves that they were in their herds, they had to pull. And we know those are high risk calves. So that actually tells us that there's 26% of a normal herd that's high risk, but we don't actually know that. So this is a research project that was done at the University of Calgary, and it was done by my associate, Dr. Elizabeth Homorowski. She did her master's work between 2014 and 2016, and she looked at to generate a predictor for calf vigor at birth. And so the operation that she did a research on was an 800 head cow-calf operation in the Calgary area. And in this study, they had 77 newborn calves that they enrolled in the study and got information from. So the total number was 77, and of that 77, 22 of them were normal controls. And so in this particular study, a normal control by definition would be a calf that was born on its own. They had 41 calves, which was 53% of the 77, that they were hand pulls, and they classified those as easy pulls. They had 14 calves that were hard pulls, so they had to use a calf jack to extract them. They didn't include any cesareans in this data set. They were all calves that were pulled. And so what they did in this study, this is how they classified them at birth. When these calves, and so they took these measurements on every one of these 77 calves, and the information that I'm going to talk about now doesn't relate to the whole 800 in the herd. It relates to the 77 that were involved in the research project. At 10 minutes of age, they wrote down a bunch of took all sorts of information about the dam and about the calf and about the environment. And then they took some measurements on the calf, TP, temperature, pulse, respiration, description of the appearance. They did this suckle reflex that we're going to talk about in a minute, and then just kind of did an overall assessment of muscle tone and reflexes. For the first 4 hours of birth, they watched those pairs to see if that calf nursed on its own or not. And that's a very important part of this, is to see if the calf would nurse on its own. And that was an important part of deciding this whole vigor assessment tool that we're going to talk about in a minute. And any calves that didn't nurse on their own, then they went ahead and supplemented the colostrum, and we're going to talk about that here in a minute as well. And then for this particular herd, they also went through and got some performance and health data as the calves grew on. So in all, they collected 30 different pieces of information on each calf. But one of the important pieces that they did was this suckle response. So at 10 minutes of age, they just put a finger in the calf's mouth and let the calf nurse on their finger, and then they decided, is this calf got a nice strong suckle reflex so that it would feel like it would pull milk out of a cow's teat, or was it a weak suckle response that's not likely to actually pull milk out of a cow's teat? And so that was a part of their 10-minute assessment, was this suckle reflex and classifying it as either weak or strong. So if a calf has a weak suckle reflex, why would that be? Well, in simple terms, they probably didn't get enough oxygen early in life, and they are trying to recover from that. And they will recover from that. The problem is it might not happen soon enough for them to get colostrum into their system as quickly as they need it. So that's the main reason when we talk about muscle tonicity and reflexes and acidosis, which, acidosis is caused when animals aren't breathing properly and they don't get enough oxygen in their system. The main reason behind all this, of course, is that they weren't breathing properly when they were born. So, when Elizabeth ran the statistics and did the numbers, overall, on the data set, she had 14 animals that were classified as weak and 63 animals that were classified as strong. And when you ran the statistic on that, the calves with a weak suckle reflex were 42 times less likely to nurse on their own than the calves that had a strong suckle reflex. So I'm going to show you some more information, but this is pretty clear now that if a calf doesn't have a strong suckle reflex at 10 minutes of age, it's probably not going to nurse properly, and at least not nurse properly soon enough to get colostrum. So if we kind of work through what she did here, the calves were all classified by whether they were unassisted, easy pull, hard pull, and then on top of that, she overlaid whether they had a strong suckle reflex or a weak suckle reflex. So in the calves that were born on their own, and now these numbers at the bottom, and we're looking at the negative here, all right? So this is the probability of not consuming colostrum on their own at 4 hours of age. So if they were born on their own, only 8% of those didn't nurse on their own at 4 hours, but 78% of them didn't nurse if they had a weak suckle reflex. And of course, as you can see as this talk goes on, there's a lot of value in making sure that none of these animals wind up on the right-hand side. If we look at the calves that were hand pulls, things are moving up, which is there's less animals nursing on their own. So even if they had a strong suckle reflex, there were still a quarter of them that didn't nurse on their own, and almost all of the ones that had weak suckle reflexes did not nurse on their own. And then of course, if we head to the right and look at the animals that were a hard pull, half of those, even with a strong suckle reflex, still didn't nurse on their own. Now there could have been other things. Let's face it, if you look at calf jack on a calf, I mean, even if he had a strong suckle reflex, he may not want to stand up and nurse within 4 hours. And of course, if they had a weak suckle reflex and a calf jack pull, I mean, pretty well all of those wouldn't nurse on their own. So the take-home message, or the simple conclusions here, of course, is that if they're born on their own, most of those will be fine, but there still is a percentage that would benefit from colostral supplementation. So again, if we go back to the Saskatchewan work and say a third of them didn't have enough colostrum, even though there didn't seem to be a problem with them, you can see that unassisted animals still can have problems. So, just gonna go back here. For me, the take-home message is quite simple, that I'm gonna start at the right-hand side. Everything here, I would assume, didn't get any colostrum, and I am going to make sure that I supplement them with everything they need so that they don't have to rely on their own strength to do it. On these easy pulls, you know, we still need to supplement them. There's a high probability that they're not gonna do it on their own. And in my opinion, if I'm gonna supplement a calf, I might as well supplement him all the way instead of giving him some and assuming he's gonna do the rest on his own. The harder decision, of course, is calves that are born on their own, what do you do with them? And I mean, I would not suggest for a second that people run around in their pastures chasing healthy calves and doing suckle reflexes, because there's gotta be more to life than that, unless you really like roping. But that said, if you are a tag at birth guy or a band castrate at birth guy, if you're touching them that first day of birth anyways, then I would say stick your finger in their mouth and do this suckle reflex to see, because you're gonna find some calves that aren't that strong, and if you've got a hold of them anyways, then I say I would probably not give them the full supplement. I would probably give those calves the partial supplement, because at least I'm gonna assume they've got enough strength to get some nursing on their own. But I would only recommend that you do this on unassisted calves if you're touching them anyways. If your system is not touching newborn calves, which in this country, most people are probably like that, then leave them alone, unless there's a reason to do that. So, looking at a few more numbers again, this is from Elizabeth's work. If they didn't nurse on their own by 4 hours, there's a high probability that they didn't get adequate passive immunity. They got 2.8% chance of getting sick, and their average daily gain was reduced by 0.2 pounds per day. So, from this part of my talk, the take-home message is about maternal recumbency. Not all unassisted calves don't need help, and calves with if you're not sure, use this suckle reflex to decide whether or not you should jump in and give that calf some help. So, if we're giving help, what are we giving them? Well, the obvious thing is we need to give them colostrum supplementation. And there is a lot of information and a lot of field experience that so many calf diseases can be traced back to those calves didn't get enough immunity at birth. So just to kind of map out the timelines on colostrum consumption, ideally we want them to get what they need within 4 hours. We really want them to get what they need within 8 hours. As people know, the colostrum is antibodies, which are very large proteins, and early in the calf's life, the absorption pores in their gut are very wide open, and these big proteins can get through them and are absorbed into the bloodstream, and that creates this immunity that goes into their blood, and it stays there for several months afterwards. And Danny's talked earlier about using these vaccines in newborn calves in Newell, and the conflict between the immunity in their system from the colostrum and the immunity that we're trying to create from the vaccines. It's still important. What I'm saying is that the immunity that's in their system, some vaccines can power through that better than others. And this intranasal Enforce vaccine that we were talking about, it works in a different part of the immune system, so it's not really affected by colostral immunity. So, between 8 hours and 36 hours, the gut just gradually closes down. The antibodies aren't absorbed anymore. They're broken down, and they're just actually absorbed as protein for nutrition, not antibodies for disease protection. So, to make a really general statement, the average calf needs 2 liters of colostrum within 4 hours of birth. And if he gets that, and if the colostrum is decent quality, he'll be fine. If you want to break it down a little bit more specifically, a calf needs 5% of its body weight in colostrum early enough in its life so that it can absorb all the immunity in there. So an 80-pound calf needs about 1.8 liters. You know, a 90-pound calf needs about 2 liters, and so on, depending on the birth weight of the calf. This is my partner, Elizabeth, again, and she loves dry markers on her pickup truck with her. So she drives down the road, and when she's in a feedlot or in a cow-calf operation, she's always writing all these notes on her window. And so this is her little trick for cattle producers when you're trying to write stuff down and you know you don't have a calving book or you don't have a piece of paper. She says keep dry erase markers in the cab of your truck, and you can just write your notes on the window. So where do you get colostrum from if you're going to supplement it? If you're going to use natural cow colostrum, the best thing is obviously your own herd, mature cows that are healthy, milk it out. The first cows that are calving, you can put it in the freezer and use that. The other one, and honestly this is what most people do now, is because they'd rather spend the money on this commercial stuff because then it's just easier and simpler, and then you know for sure what you got. Because the stuff that you buy is kind of certified in a manner that you know it has the immunity that they say it does. But what people don't do is, or what you shouldn't do, is use dairy colostrum. Is there any dairy farmers in the crowd? Okay. So, and the main reason is because the incidence of Johne's disease in dairy herds is much higher than it is in beef herds. And Johne's disease is a weird bacterial disease that causes chronic wasting diarrhea. And when it gets in your herd, it's kind of insidious and it's really hard to get rid of. And so it's not something you want. And especially if you're a purebred breeder, because, you know, it's one of those diseases that they've had it for a year or two before they go clinical on you, and by then it's kind of in your herd. So you really don't want it. And one way to get it, of course, is to buy an old dairy cow, use as a nurse cow, or go to a dairy and get colostrum from them and use that to feed your calves, because you can infect the calves through that. The other thing about dairy colostrum is, because the volume's so high, the concentration of antibodies is lower. And actually, for what this is worth, the ideal cow for colostrum production is a beef dairy cross. They've actually done research that shows that you've got this magic sweet spot of good volume and good concentration in a beef dairy cross. So for colostrum, if you're going to use your own, you can freeze it up to a year. You can only thaw it out once after it's frozen. Don't freeze and thaw it repeated times. Don't use a microwave, because warming activity of microwaves break down the proteins, so instead of being nice antibodies that protect disease, they're just proteins for nutrition, and it defeats the purpose. Like if it's a high melting breed where the concentration is lower, you may need to use a higher volume that we talked about earlier. And you know, when we talk about 2 liters, some newborn calves actually physically aren't big enough to take 2 liters at once. So you may have to split that up into 2 feedings instead of 1. And then this just kind of shows the colostrum quality on heifers versus cows. So, you know, heifers their body hasn't been exposed to as many diseases, as many vaccines, and their milk production isn't as good. So the antibody concentration, and IgG is the main classification of antibody that we talk about when we talk about colostrum. You can see that these heifers are the dark brown bars, and that's the amount of IgG that was in them, and the cows obviously had more and better quality colostrum. So if you go to the clinic and or you go to a feed store or whatever and you're buying colostrum, there's 3 basic types. There's the stuff that's called a supplement, the stuff that's a replacer, and then there's a replacer with energy in it. So to make a general statement, when we say 2 liters of colostrum, we really want them to have 100 grams of that IgG antibody. And so we know that this package has 100 grams in it, and this package has. So if you give a calf one of those green bag replacer products, he's got everything he needs, and you could literally feed him just milk from then on and he'd be fine, because he got all that immunity he needed in that one package. These other packages are replacers, and of course they've got 50 to 60, so it's pretty simple. You could take 2 of those package and make a replacer. But these are for when you think they got some from the cow, you're just trying to make sure, you're just trying to boost it up a little bit. So one kind of important thing is, I'm talking about how many grams of the active ingredient is, but if you take one of these packages off the shelf and look at it, on the outside it says 225 grams. So you might think, oh, well, this has got twice as much as I need, so I only need to do half a pack. Problem is, that's what the weight of the whole bag weighs, and all of the milk and all the other carrier ingredients, it all adds up to 225 grams. If you flip that over and look at the fine print on the back, somewhere down there it'll say 100 grams of IgG. So make sure you don't get confused with the weight of the bag versus the quantity of immunity that's in that package, okay? And so, you know, when would you use this high energy stuff? It's when it's cold, the calf's stressed. You want to make sure that it not only gets enough immunity in that system, it gets energy to kickstart it in life. So, oops. There we go. And if you're kind of buying this stuff or you're not actually sure, there is a simple way to tell what's in it, and that's the price, right? As you would expect, the more that's in it, the more it costs. So this is $20-ish, and then you work way up to $40-ish. So it seems like a lot of money, but it's a money well spent when you are talking about a calf. The last little part of this is how do you get it into them? So there's no question that the best thing is nursing. The second best thing is bottle feeding, and then tubing is last. And the reason that nursing and bottle feeding is best is because of an anatomical feature in baby calves called the esophageal groove. So this is kind of a schematic of cow's stomach, and as I'm sure everybody knows, cows have 4 stomachs. The first 3 stomachs are basically set up to do the fermentation of forages, and that's why cows can break down all the nutrients in forages, is because the rumen is a gigantic fermentation vat. And the absorption of those nutrients does not happen in the first 3 stomachs, it happens in the 4th stomach and beyond. And the 4th stomach is called the abomasum. But because calves don't eat forage, all they do is have milk, the body is designed so that when calves are nursing and swallowing in the nursing act, this thing called the esophageal groove kicks into gear and shunts that milk straight from the esophagus into the abomasum and bypasses these 3 stomachs. So if a calf is nursing, or if it's nursing off a bottle, the esophageal groove comes into play and it goes right where it's supposed to. If you tube feed it, they're not going through that swallowing act, and so it just goes down and gravity takes it into the rumen. And so then what you need to do is you actually need to feed them more so that the rumen overflows into the abomasum, and then they can absorb those antibodies that we are trying to get into them through the colostrum. So take-home message on colostrum is 2 liters within 4 hours of birth. Think about where your colostrum comes from, and you know, how that might affect the overall health in your herd. And the magic number, if you're looking at packages, is 100 grams of IgG, and you will give that calf everything it needs. All right? Any questions?